Dr. Monarez, I agree with you completely that we need to restore trust in public health. But in order to do so, we have to have a discussion about the actual science, and we can't have a discussion this, is about all vaccines are good, all vaccines are bad. This is about specific vaccines, it's about specific age groups, and it's about specific policies. Does the COVID vaccine prevent transmission?
The COVID vaccine can reduce viral load in individuals who are
Does it prevent transmission?
When you have reduced viral load, you will have reduced transmission.
But in other words, it doesn't prevent transmission. You can still transmit the virus if you've had the vaccine. In fact, there's been reduced ability to interfere with transmission over time. And what we've found is the most recent one since Omicron is down around 16% reduction, if there is a reduction. Does the COVID vaccine reduce hospitalization for children under 18?
It can.
It doesn't. The statistics are inconclusive, and the reason you can't prove that it does is there's so few people under 18 that go to the hospital. The numbers are extraordinarily small. There's like 76 million kids under 18 in our country. 183 died, and a few thousand went to the hospital in 2020 and 2021. And since then, the numbers have dropped precipitously, and the idea and the issue needs to be discussed. But the COVID vaccine is not reducing hospitalization. It's not statistically significant. Does the COVID vaccine reduce the rate of death for children under 18?
It can.
Once again, it can. That's a ridiculous answer. No, it doesn't, and there is no statistical evidence that it does reduce the death rate. These are statistics. We've looked at it. When they approved it, they had this discussion at the vaccine committee that we've been talking about. During the discussion, they acknowledged that there was no proof of reduction in hospitalization or in death. So what they did is they said, what can we use to try to make people take this vaccine? They came up with this. They said that if we give you a COVID vaccine, you make antibodies. So really the whole recommendation for having a COVID vaccine from 6 months up is not based on hospitalization data, not based on deaths. It's based on whether you make antibodies or not. And what people fail to see from this is I can inject you with a foreign protein every week and measure your antibodies. You'll make antibodies every time. It just means immunology work has nothing to do with whether you should get a vaccine every week. So when we're discussing the science here, we have to discuss what is the science in favor of giving a vaccine to a 6-month-old and what are the benefits from that. And there is no benefit of hospitalization or death. And then what would the risks of the vaccine be? We have large population studies of the risks of the vaccine in younger people. And it turns out that you don't see this as much if you look at the general population, but once you start isolating in by age group, which you have to do in COVID because there's such a disparity among age group, you find that there is a risk of myocarditis, a significant event. It's somewhere between 6 and 8 in 10,000. But that's much greater than the risk of hospitalization or death, which are not even measurable because they're so small. So you resisted firing people who have this idea that the COVID vaccine should be at 6 months. That's what this is about. You didn't resist firing the perfect, beautiful scientists that are career people and unobjective and unbiased. You wouldn't fire the people who are saying that we have to vaccinate our kids at 6 months of age. That's who you refuse to fire.
So that assertion is not commensurate with the experience that I had with the individuals who are identified to be fired.
Did any of the people you refused to fire, did any of the people you
refused to answer the question?
Did any of the people you refused to fire believe that we should change the vaccine schedule and no longer force 6-month-old kids to take it? Every one of them was adamant we should keep it at 6 months. Everybody's alarmed, we're going to change the childhood routine. Well, we should. There is no medical reason. What is the medical reason to give a hepatitis B vaccine to a newborn whose mom has no hepatitis?
So none of the discussion points that you just brought up were ever...
That's changing the childhood schedule.
Do you allow her to answer the question?
Regular order,
You
regular
have
order.
your time. You have your time, Bernie. I got mine. Look, this is the debate over changing the childhood schedule. The hepatitis B vaccine on the schedule is given to newborns. What is the medical, scientific reason and proof for giving a newborn a hepatitis B vaccine if the mom is Hep B negative?
I want to go back to the assertion associated.
What is the medical reason for giving a hepatitis B vaccine to a newborn? See, everybody's like blithely going along, we can't change the childhood. You're somehow terrible if you want to change the childhood. We should be discussing what is the childhood vaccine schedule, and the burden should be on you. You want to make all the kids take this? The burden is upon you and the people you wouldn't fire to prove to us that we need to give our 6-month-old a COVID vaccine and that we need to give our 1-day-old a hepatitis B vaccine. That's what the debate ought to be about, not whether all vaccines are good or whether we live in Alice in Wonderland.
I actually agree with you, and I was open to the science. I just would not pre-commit to approving all the ACIP recommendations without the science.
Untrue.
Is the witness allowed to answer that question, or do I have to use my time?
She answered the question. Did you have more to say, Dr. Monarez?
The last thing I wanted to say about those scientists, we had never discussed any of their thoughts, considerations. Or
We being we, who's we?
me and the scientists that I was being asked to dismiss. As far as I know, they had never said that they are pre-committed to maintaining any of the decisions that had been made. All of us had agreed that the science evolves and we need to see the data and the evidence to ensure that we are protecting our children.
Okay. Senator Murray.
Thank you. So, thank you so much for being here. And Dr. Monarez, I appreciate your time coming before this committee again. I'd like to go over some timeframes first. But first of all, who fired you?
I believe the president fired me.
Okay. Do you serve at the will of the president?
I do.
And just for the record, the president's removal power is rooted within the Constitution's separation of powers and are necessary to ensure that the executive branch officials are aligned with the administration's policy. This means the president can remove them at any time for any reason or for no reason at all. Would you agree with that?
I would.
Okay, so what day was you fired?
I believe I was fired on August 27th.
Okay, what day was the first time you seeked counsel? Not retained, seeked counsel.
I don't recall.
We can get those records, so maybe you should recall them, because I think you might have an honesty issue here that we want to point out. So what day was it that you spoke to the attorneys the first time?
It was on or before the day I was fired.
No, that's when you retained them. You already testified to that. When did you speak to them?
Again, it was on or before the day I was fired.
So you retained them the first time you spoke to them.
I believe that I retained them the first time I spoke to them.
Was you let go in the middle of the night? Was you let go in the middle of the day?
I believe.
Now, I know the answer to this, so let's be honest here.
I believe I received. I believe I received an email from the White House indicating that my services were no longer needed.
What time was that?
Sometime in the afternoon, sometime in the evening.
Late evening, late afternoon, late evening?
Probably.
And so you got hold of the attorneys late at night?
I'm sorry, what?
You got hold of the attorneys after business hours to retain them?
I don't recall.
I think you do.
I really.
I think you don't recall retaining your attorneys.
I don't recall the specific time or day that I returned them.
See, I'd still think you have an honest issue because it wasn't that long ago. And I think I could recall when I hired an attorney. And I could definitely recall the time I did it. Now, let's ask, when did you remove the political appointees from the floor that you work on?
Again, I did not, I moved some political appointees in, and I put my senior advisors together.
When did you remove them and remove their access to your floor? And you had a conversation with the secretary about this. When did that happen? Like how many days into your job?
I'm sorry, I don't even know what you're asking.
Yeah, you do, because you already talked about political appointees that the secretary had put in place. You removed the political appointees that was in there when you first got to your work. When did you remove them from your floor and take away their ability to access your floor? And you know exactly what I'm talking about because you and the secretary spoke about that.
You're miscontextualizing.
No, I'm not. I'm asking the question, what day did you remove them?
I moved. I have one political chief of staff. I have 3 political chiefs of staff. I had space made for all of them in my suite.
When did you remove the political appointees before, or the political hires before you got there, that was there prior to you getting there? This isn't hard. It's not hard.
I
You
didn't-
talk in circles, and I just want an answer, because you know.
So I had the security of my suite.
Okay, so let me ask you something. Your conversation with the secretary, you said that he said he didn't trust you.
Correct.
You testified to that. Is that really how that conversation went? Because there's other people in the room, and I think the conversation was, can he trust you? And your answer was?
He said he could not trust me.
No. The answer, ma'am, it was a recorded meeting. So you can testify one way, or you can prove that you're lying, or give them and be honest with this committee.
He
And I'm
said-
giving you the opportunity to be honest here, because you've been really walking around the edges and not being truthful. So did he ask you the question, can he trust you? And your answer was?
He told me he could not trust me. And I told him if he could not trust me, he could fire me.
That isn't how that conversation went. And you know that, don't you?
He told me he could not trust me, and I told him if he could not trust me, he could fire me.
Ma'am, all we're looking for is you to be honest, and you haven't been. You're not being honest with the conversation you're having, you're not being honest with the timeline, and you won't even give the answers of who your attorneys were. And all we're looking for is you to be honest. If we're gonna have a hearing and we're gonna discuss certain things, let's make sure we're talking with someone that we can trust your answers. It's like my kids, I tell my kids all the time, you know, one thing I want from you, I can deal with any situation we walk into as long as I know you're being 100% honest with me. The minute I can't tell you're being honest with me, I can't trust you. From then on, everything you say is questioned. And you have to question you because your personality and your answers aren't correct.
Madam
Therefore, I
Chair.
yield back.
Senator Markey.